Hello everyone, I am ENT specialist Dr. Sagar Rajkor. Today's video is regarding sinus headache symptoms. First of all, there are only two people whom you should contact in case you have sinus headache or headache. First of all, ENT specialist doctor, and the other one is neurologist. Uh, so why you should know this thing? Some people say if we have to approach this specialist doctors, then why we should know these things? No, it is true that you have to approach this doctor, but if you have basic knowledge, basic information, then you can respond to treatment better. You can understand your treatment better. If you are having chronic cold, see if you have cold since you have common cold only one episode in 1 year or one episode in 6 months, it doesn't refer to significant cold. It is not significant at all. Significant cold means suppose you have cold once in 1 week or once in 15 days or once in 1 month, and each episode is lasting for 5 to 6 days, then you can say it is significant. Suppose in case you have cold once in a month and it is lasting for 10 days also, then also you can say it is significant. So first of all, in this case, if you have cold and then headache, then first of all you should contact only and only ENT specialist doctor, unless and until he does CT scan. Definitive diagnosis is not reached. Suppose you are having cold only since 5 days, then ENT specialist doctor will not advise you CT scan. If you are having chronic cold, say suppose several episodes, 2 to 3 episodes in 1 month, each episode lasting for 5 days, or one episode in 1 week, each episode lasting for 3 days, and this is continuing since the last 2 years, 1 year, then only your ENT specialist doctor will advise you CT scan PNS. CT scan PNS means CT scan parallel sinuses, otherwise not. If you are having just allergic rhinitis on CT scan, he will advise you only conservative treatment. But if significant and symptomatic deviated nasal septum is there or sinus problem is there, there are hollow spaces. These are maxillary sinuses. Here we have the frontal sinuses above and middle to your eyes, and middle to your eyes we have the 8-point sinuses. All these have drainage in the lateral wall of nose. This is the lateral wall of nose, and the drainage point is common. So if this drainage point is blocked, all the sinuses get filled with fluid, and patient has complained with nasal blockage, sneezing, rhinorrhea, and all these things. So on CT scan, if sinus blockage or sinus accumulation is seen and it is significant, then sinus surgery is advised. If significant deviated nasal septum is there, then only septoplasty is advised. If only and only allergic rhinitis is there, then you have to follow certain restrictions and no surgery is required. Okay. If nasal polyps are there or conchobullosa is there, conchobullosa is the middle turbid, which is normal projection from lateral of nose, which gets enlarged. It is abnormally enlarged and it causes nasal obstruction. So enlarged middle turbid is called conchobullosa. So conchobullosa trimming is advised in case if it is there. So all this depends on the judgment of the ENT surgeon. Failure to conservative treatment for several times and since long duration. After undergoing CT scan, only then these things are advised. Suppose patient is complaining of headache and there is no episode of this cold and all anything, then the patient can directly go to neurologist. Neurologist is best possible person to consult the patient. Okay. So besides common causes of headache, as we all know, okay, if there is lot of stress, inadequate sleep, frequent acidity, constipation, fasting, all these things can cause headache. If any ophthalmic problem is there, then also it can result in headache. So before approaching a doctor, you can get these things clear. After clearing all these things, even if you have headache, then in that case you need to consult a neurologist if there is no cold problem, or ENT specialist doctor first and then neurologist. There are many cases we have observed in the last many years of our private practice that patient has combination of both problems. He has headache due to cold, and then he has got some neurologic problem also like migraine and other things. So such patients underwent surgery from us They underwent surgery from a nasal polyp surgery, sinus surgery, septoplasty. After that also they started saying that they have headache. So initially we give idea to all patients that whatever we are going to achieve by surgery, say correction of deviated nasal septum or removal of polyps, correction of sinus problem, trimming of conchobulus, all these things can be achieved. But even if there is problem of headache, then you need to consult a neurologist. Clear cut idea is given to the patient from the beginning itself. Very soon we will be coming with our next videos. Thank you very much.